webinar today. The floor is you, Dr. Amin.
Assalamu alaikum. Good evening and good morning for everyone. It's my pleasure to be here. Thank you, Dr. Nagwa. Thank you, Dr. Amani. Thank you for the Global Health Activity to invited me for this webinar. And it's my pleasure to speak about patient experience and the way it's matter. Patient experience from beginning, it's something we adopt from other industry as usual. It started by customer experience. Many people now talk about patient experience and why patient experience and why this replaced patient satisfaction and what is the difference between both. Today I'm doing, my presentation. I collect most of the important studies which talking about both, and let's think together at the end of this session, what is important, patient experience or patient satisfaction? Is my my presentation has been shared?
Yes, Dr. Amin. Go ahead.
Okay. I will start, our presentation. When, this is one of the comment has been taken from one of the customers. He's going to one of his favorite restaurant. He said that my wife and I stopped to our local Chang restaurant for a lunch last month. It was beautiful, Florida spring day, and since it was midweek, the restaurant wasn't too busy, so we decided to sit at the patio. However, when we asked the hostess to seal outside, we were told that it would be available within 15 to 20 minutes before we could be seated. However, we could be seated immediately if we wanted to sit inside. When I asked why we couldn't be seated immediately, since about half of the tables were open, we were told that there wasn't enough staff scheduled on the patio to serve more tables. This service staff did not have the decision-making authority for creating good customer experience. So we have here customer experience. The second, from the perspective customer, if there was enough staff in the restaurant to serve the total number of customers, then why wouldn't they simply relocate some of the inside staff to serve outside on the patio? If the hostess was delegated the decision-making authority to take initiative to make every customer experience as a good to great one, then perhaps they might have result differently. Second story we have from Marriott. Marriott very, very good branches and, have very good, name. If you are going to book your hotel, you will go to think about Marriott. One of the customers, he said, I stayed in a new Marriott Courtyard Hotel a while back. The situation was that it was recently opened and shouldn't have been opened until the problems were well worked out of the management was ready. There were many problems. Believe me, it started as significant customer failure. Here, our customer think about customer failure. But not only did the staff take care of the issue for me, this manager, once he got me back, even continued to build the relationship with me. His technique, including exceptional personalized service, using my name and face-to-face greeting, and continued follow-up and attention to details. He actually made me believe that I was the best customer he had ever had. Not only did I forget that about earlier problems, but I was feeling great about the entire 3 days experience. So he started by very bad experience and failure in his system and failure in service, then converted to the best 3 days he have experienced with Marriott. From here, we can start. For our healthcare system and facility, who's our customer? He's the patient. So today, we will ask about patient experience. But before we start, we have to understand what is the meaning and what is the definition of patient experience. I started, very early, starting in 1992. The Institute of Patient and Family-Centered Care established the 4 guiding principles for family and patient engagement, which is depend on dignity and respect, information sharing, participation, and collaboration. In 2001, the Institute of Medicine defined patient and family engagement as providing care this is respectful of and responsive to an individual patient preference, needs, and values, and ensuring that patient values guide all clinical decisions. Here, we're still talking about patient and family engagement. In 2007, the Pearl Institute started to speak about the first time, and this is the first time we hear about patient experience, which is defined as the sum of all interactions shaped by an organization's culture that influence patient participation across the continuum of care. I'm saying this is the first time we talk about patient experience as a patient experience. Then we have the very wide, details about patient experience started by Agency for Healthcare Research Quality, ARHQ, which gave the range of interactions the patient have with the healthcare system, including their care from health plan and from doctor, nurses, and staff in the hospital, physician practice, and other healthcare facilities. As an integrated component of healthcare quality, patient experience includes several aspects of the healthcare delivery that patients value highly when they seek and receive a care. Such what getting timely appointment, easy access to information, and good communication with healthcare providers. Then NHS give the main 8 categories for patient experience, which regarding to respect for patient values, preference, and needs, coordination and integration of care, information communication education, physical comfort including pain management, emotional support for clinical fears regarding the patient and their family, involvement of family and friends, transition and continuity between location and type of care, access to care including the waiting time and time between admissions. Till now, we are talking about experience, and this is how the patient experience looks like. So what is the difference between patient experience and patient satisfaction? Most of the time, before we are used to have patient satisfaction, and we believe that really patient satisfaction is a very good tool for us to use and to think about how the patient and our customer will think about our service. So patient satisfaction is about patient expectation for his or her care encounter. And this is, according to ARHQ. In other words, patient satisfaction is a subjective health care measure. There is 2 patients can receive the exact same care, but have different satisfaction level because they had different subjective expectations. I will give you an example. If you asking patient if they had access to their health record, it's a measured patient experience. Patient here have data access is an objective quality measure. But if you are going to patient satisfaction, would go about determining if the patient was pleased with the room layout, while there are some standards that would be conducive to high exam room satisfaction score, which is ultimately subjective matter. Patient satisfaction appear to be a far less official measure or concept in the healthcare space. Healthcare professionals may place a high value in patient experience. Why? Because it's had the power to spark a quality improvement in the clinic and hospitals. Conducting a patient experience survey, which can be like Persgany survey, we have different survey, can help determine whether objective quality measures have been met. Means if you are using patient experience, you will have the opportunity for improvement. For example, if did the provider discuss the charge and follow up care details for a patient? This is one of the questions can be asked during the patient experience survey. A yes or no answer here will guide us to give actionable insight into whether the hospital experience actually improved the patient care, not whether or the patient has a good time. And all of this is not to say that patient satisfaction is not important. The healthcare industry has become consumer-centric, especially as patients spend more of their own money to pay for healthcare. Organization leaders also looking for drive patient satisfaction and not just experience to maintain a growth for their market. So now, which one we have to follow, patient experience or patient satisfaction? So the importance of patient experience that enhance patient healthcare experience means more than just providing top-notch clinical care. It requires care that address every aspect of patient encounters at the clinics, their physical comfort, their understanding, what's happening, and what their emotional needs. There is a triple aim framework to reinforce the importance for achieving a goal in any healthcare. They have mainly 3 goals. The number 1 is about improving patient experience of care, improving health of population, and reducing the per capita cost of care. The first of one is we start, as you see, starting by patient experience. And the benefit only not the patient, but also clinic treating them as well. We have also a better patient experience result can be improved for clinical and business outcome. If I'm going to patient experience, it will begin with their ability to get an appointment. So the patient, he starts his journey by the ability to get an appointment, and when they need it, because the patient, I need appointment now, and then continue to completion of their appointment, and ultimately their longer term care plan. Their satisfaction here will be affected by the ease for the logistic, how he got his appointment, how he have ease to his parking and finding reception. Here we are combining between the patient satisfaction and patient experience. Here I'm going for one study, under the name Your Voices Matter. It was 2014, and they found that the top 5 drives of patient satisfaction where patient perception were the following. The provider cared about me as a person, and the provider listened carefully to me, and the provider knew important information about my medical history, and the provider explained things in a way that easy to understand, and the provider answered all my questions to all my satisfaction. So we have now 5 main goals. As we see, it depends on emotion and feeling and how the provider will provide the care for the patient based on his perception. We mentioned here that the patient experience would have a clinical benefit. I collect some of the studies which talking about how really patient experience will affect the clinical benefit. The recent study was found that major determinant of patient satisfaction were physical comfort, emotional support, and respect for patient preference. And according to the Agency of Healthcare and Research and Quality, improvement in patient experience are linked to improvement in clinical outcome. And the multiple studies was in the last 2 decades has concluded the same thing. Patients are more likely to accept medical care and follow treatment plan if they feel they communicate well with their provider. Just remember, we have to communicate. A 55 study research also review found a positive association between patient experience and health outcome, adherence to treatment plan and medication and preventive care. I will give you examples. They discover here that patients with HIV reported that if their provider knew them as a person, they were more likely to adhere to treatment than if they didn't. Here we have to build a communication and relation with our patient as a person. And as we know that HIV is very difficult to treat and the patient is so sensitive. Can you imagine if our provider, he built a relation and a good relation and based on communication, based on listening to his needs and about his experience, really it's affecting his health. Another study showed that a positive correlation between physician perceived empathy and attractiveness and cancer patient capacity to deal with their disease. And this is one of the most chronic and hard disease. If we are talking about, the outcome benefit and the clinical benefit, we have to think about, as we mentioned before, a business benefit, which is all the healthcare leaders have to think about. Practices with strong physician-patient communication relies a number of business benefits, such as better patient retention, patient reporting poor quality relationship with their physicians were 3 times more likely to leave the practice than those with highly quality relationship. And we're talking about patient-centered communication is also associated with fewer unnecessary diagnostic tests and specificity referral, as well as better recovery from discomfort and better emotional health 2 months later. Continuing with business, and I think this is very, very important point, patient or physicians with high empathy score were significantly more likely to have a good control of hemoglobin A1C, more than were patient or physician with low empathy score. We are using here the word for empathy. Can you imagine if the doctor with his patient show high empathy score, it will be good to have result for controlling hemoglobin A1C. I think we have to think about this one and think about, we have new language about empathy here. Evidence from 55 studies indicate that consistent positive association between patient experience and patient safety and clinical effectiveness for a wide range of these areas. There were positive associations between patient experience and self-rated and objectively measured health outcome, adherence to recommended clinical practice and medication preventive care and resource use. So what is the difference between the survey for patient experience and the survey for patient satisfaction? We can use both of them. Yes, we can use both of them still, but I'm telling to you, the way you are putting your survey is different. If I'm talking about patient experience, it will be referred to what happened to an individual when they are interacting with the healthcare system based on their participation, perceptions of those interactions. Survey designed to measure patient experience include but go well beyond sample rating of satisfaction. The majority of questions ask patient where or not or how often certain event or behavior actually occurred. In contrast, if you're talking about patient satisfaction surveys, use rating to a certain of person's feeling about their care, such as a very satisfying to very dissatisfied, which are much more subjective. Patient satisfaction may be reasonable measure for business reality, but itself, it's not strongly linked to improve healthcare outcome in any meaningful way. So all of that, what you wanted to say? You want to say that, it's not to say patient satisfaction is not important. Still important, and we still need it, and we still to have to use it. The healthcare industry has become consumer-centric, as I mentioned before, especially patient has been sent more their own money to pay healthcare. And we need to think that organization leaders, they are thinking about their business and they are thinking about, patient satisfaction, not just experience. So we have to think about to make balance between experience and satisfaction. Consumers have more choices and healthcare decisions impact their wallet more. They will increasingly compare their healthcare experience to the expectation they have developed in other aspects of their lives. Ultimately, providing a quality care encounter will help drive high patient satisfaction. So patient satisfaction and patient experience may go hand in hand. The way that we approach improvement for patient experience measure is to reframe it. And exercise is not to make consumer happy. The exercise is to reduce patient suffering. So the aim here is very clear. We need to make patient less suffer, and we don't want to make him happy because really he have to be suffer because of his pain, but at least we can work in his experience during his journey in our facility. While the goal is to drive patient experience and reduce hospital harm, these efforts require providers to look at the element of patient satisfaction. I will give you an example here. Look to this picture. If we make sure that the patient is stay in our hospital and watching TV program, which she like or she prefer, and it may prevent her from reaching too far, searching for remote control, thus potentially preventing the patient from harm or injury. Here we do something for patient suffering, and we are, also save our organization. My take-home message for today, that the definitions for patient satisfaction and patient experience are indeed closely linked. In the same time, we can say it's codependent. However, using both patient satisfaction and patient experience interchangeably could lead to improved patient-centered care effort. And it's important to use these terms probably to better inform care improvement effort. And this is my presentation for today. And it's time now for Dr. Amani for your comment and questions. Thank you.
Thank you, Dr. Niveen, for this valuable presentation and valuable information. Thanks for our participants, and I would like to invite them to put their questions in the chat box, or if anyone wants to interact by voice, he can raise hand and we can unmute him. So until they will put their questions, if there is any question, I have a question for Dr. Naveen, and maybe she will be surprised that I ask it now, but I think that we go through discussions like this before. I would like to ask you, for the benefit of the people attending this, to tell them how do you see the future of patient experience in Saudi Arabia, especially in Saudi Arabia?
Okay, Amani, thank you for your question. I think now this is the era for patient experience, and I think Saudi Arabia, they are doing very well. And one of the best exercise for us during, this last pandemic, COVID-19, I think we are show very good, and we try to customize ourselves how we are going for patient experience and how to respect our patients. It's not only about patient experience, but I think it's many initiatives doing now in Saudi Arabia regarding to the speak up for patient safety culture, and we are also respect our patient as a partner. If you respect the patient as a partner, may it will help your organization. It will help you. Maybe you're thinking about improvement project or one step forward, but really your patient, you think it will be easier if you're doing the same way. So my belief now that we have to think of for our patient as a partner, involved in every step. He's not only coming to take treatment or facility or care plan, but really he's a very good partner. And I think Saudi Arabia here are doing very well. The culture here is very strong, especially most of the people talking about patient experience. The aim for this presentation, really, Dr. Amani, I don't want people to think that patient experience came so we have to overcome or forget patient satisfaction. They still can go together, because when I start a project, I will do an action, I will do a quality improvement project, or I will go a jump for treat, means I have to think about what I'm doing. My patient will be satisfied or not. That's why the aim for this presentation.
Thank you, Dr. Naveen. And now we have questions in the questions and answers. One question is patient experience associated with patient safety?
Yes, this is one of the things we have to study and talk about, that really patient experience matching with safety. Sometimes when the patient, you are talking to him, and one of the questions you are asking about, did your care provider, he do his hand hygiene? Did you feel your stay was safe? Did you think anyone oriented you how to be exit? I think this is very important. You can take many good answers. And actually, for me, almost 3 years now, I'm working with comment from patient from my organization. I found really that the patient is very smart. And it was my personal experience that really the patient is very smart, and he noticed many things. As healthcare provider, we think this is not important. Like, I discovered that area is short of staff. I believe you have short of staff, but you have to do 1, 2, 3, 4. They give you options. And I think really it's matching with patient safety.
You know that we are in a long journey of patient engagement in my hospital, and I heard one statement from one of our nurses. It was it really, I can't forget it. When we implemented the Care Partner program in aim to improve patient experience and reinforce patient engagement, she said that I feel like the partners or the relatives, or murafiq as we used to call them here, they are extra eyes on our patient safety. They are the one who they can activate the rapid response team. They can monitor the vitals for the patient. They can help in a lot of things, and they can be, as she said, extra eyes on our patient safety. So for the one who asked the question, this is the answer. And the second question is from Mr. Muhammad Ahmed. What are the rules of patient experience in pharmaceutical care? It seems like he's a pharmacist. Okay, Dr. Muhammad.
Okay, Alan, thank you, Dr. Muhammad, for the question. Pharmaceutical care, when you are dealing with a patient, you are dealing for outpatient clinic and inpatient clinic. Sometimes, the patient needs counseling. Sometimes the patient, you ask about his journey. The important for the patient that he wanted to have access. I always say to my colleague in my hospital that, the pharmacy is the last step. Whatever he met in his, his journey in the hospital, it will impact in you in the pharmacy, because he have problem to get an appointment. He has a problem for long waiting time in outpatient clinic. Maybe he has a problem for waiting for the doctor. Maybe the doctor, he didn't treat him in a nice way, the way he liked. So the final step, when he will come to you, the pharmacy, and this is the big challenge, you are the last step. So you have to think about how to make his life easy. Long waiting time affect the patient too much. I'm telling you, 1 minute for the patient in the pharmacy, almost like 2-3 hours. If he can wait in the OPD clinic 1 hour, but he cannot stay 1 minute in front of pharmacy. How to deal with him with the dealing and the compassion. How to explain for him his medication in privacy. This is a way how you have to think. And if you are going to inpatient ward, I'm telling to you the time about discharge medication or discharge, or he will leave the hospital, he wants his medication. So you are very important. You are very important because you are giving him the medication. He believes that he will take this medication, he will be treated. So I think the very important.